Okie dokie, let's take a look and see if it is all good. I think it's all good. Let's double check on the YouTube. Let's see. How's it sounding? How are we sounding? I think we're all good on the YouTube side of things. So let me just share this on Twitter and then we will get going. You know? That's all we got to do. That's all that's left. Okay. So copy link. Here we go. Get you over there. Get over to Twitter. Okie dokie. I think that's everything. Yep. I think we got it all posted and all that stuff. So away we go. Well, good afternoon, good evening, good morning, whatever you are, whoever you are. This is Dr. Patrick Lockwood, and we are here for yet another episode of UnShrink Me, episode 48, I believe. And today's episode is going to be a good one. We got a lot of important stuff. We're going to talk about the troubled teen mental health industry. We'll talk about why the mental health profession struggles with criticism and much, much more. So much to talk about. We're even going to talk about personal responsibility. So we'll see how that goes as well. So welcome everyone. And for those of you who are brand spanking new, welcome to UnShrink Me. This is a weekly podcast focused specifically and only on what is working and what is not working in the mental health world. So the whole focus of this podcast is anything and everything related to clinical treatment of mental health problems, formal, ethical, clinical treatment of mental health problems. So this is an educational podcast. This is not a political podcast. This isn't even really a personal podcast. The goal of this podcast is just to share relatively high quality information, appropriate skepticism, and critical thinking with the world so that anyone who is seeking out mental health services gets the most well-rounded opinion that's reasonable and skeptical at the same time about those mental health services. Because a more well-informed consumer base will get better outcomes in therapy. We have decades of research that says psychoeducation is one of the most efficacious interventions and clinical treatment. And so the whole purpose of this podcast is not to provide clinical advice to people, just to be clear, so don't sue me or whatever. The whole purpose of this podcast is to show what it looks like to be appropriately skeptical and critical of the profession, of the interventions, of the topics in the industry, so that when you go out there and you seek out therapy, you seek out psychiatry, etc., you can be appropriately skeptical yourself. Not that you're avoiding treatment, not that you're a shill for treatment, not that I'm a shill for treatment. I could care less whether or not people go get therapy, because this is not a podcast about converting anyone to anything. This is a podcast about what I believe is a healthy adult skepticism and criticism of the profession, so that when you go out there, you can have a better understanding, a more critical and reasonable understanding of the professional you're talking to, or professionals, and the services you're being offered. That's the only thing I want to do, so that you can get the most out of these services. Because the more skeptical you are, the more real your clinical relationship will be. That's my belief. So welcome to UnShrink Me. I hope that this is useful, helpful, or maybe even entertaining. I don't even know. We'll find out. So the first topic today, I'm going to start with the softball. But before I start with the softball, as always, this podcast is not NOT sponsored by Celsius. But I love this stuff. And maybe one day, who knows? Oh, that's good stuff. So, tastes good, fuels me, energy, all that stuff. So the first thing I'd like to talk about today is being skillful. So this person, Jade, the BPD coach, I believe is her handle. Yeah. Her handle on Twitter is at Jade the BPD Coach. And let me repost her post because I think it's a really good one. And I'll start with this because it's a little lighter, and then we'll kind of segue into the deeper stuff. So this is a really cool thing she put out on December 8th. So I'm a little behind the 8th ball here today. Let's see here. Okay. So Jade, who I'm very friendly with online, admittedly, so maybe there's a bias. Who knows? So here's what she said. She said on December 8th, discussion topic today, how we, in parentheses, people in recovery, can use coping skills to suppress emotions just like we can use drugs or food or distractions. It's one thing to be skillful in how you manage your emotions. It's another to try and outrun them with tools. So this is an awesome topic that I think in graduate psychology in grad school where I teach, we spend semesters talking about because it's really important to understand the difference between distracting/avoiding versus tolerating and coping, right? Now that dichotomy I just outlined, distracting and coping versus tolerating and all that, that's a different framework that maybe not everyone in the profession would agree on. But anyways, generally speaking, what we can teach people how to do as professionals generally falls into two camps. It falls into either the camp of distracting or avoiding, for instance, or it falls into the category of tolerating. So tolerating can mean sitting with the full force of something, like an exposure therapy or flooding, or tolerating can mean sitting with a lesser version of it, like when you use coping skills. So the very first thing that she said for her discussion topic was how we can use coping skills to suppress our emotions, just like we can use drugs or food or distractions. So I'll start with that sentence before I move on to the next one. So here's what I think is especially helpful about this, and I want everyone to understand this loud and clear. Depending upon how insightful your clinician is, depending upon how aware of their countertransference and their bias and all these things, depending upon how healed or integrated your therapist is or your psychiatrist or whatever, they may or may not be aware of the fact that they're encouraging you to avoid things. And so let me speak about this in the big picture sense, but then I'll give a specific example. So big picture for mental health, generally speaking, even though mental health is not a very well-defined thing, it's very much the case that people in the profession should be, I'm going to use the should word, it's very much the case that people in mental health treatment as a profession, they should be helping you learn to tolerate your feelings better. Because most types of mental illnesses involve some degree of pathological avoidance, especially anxiety disorders, especially trauma disorders, and personality disorders, and substance use disorders, and eating disorders. Pretty much all types of very severe pathologies involve pathological avoidance. And so we can engage in pathological avoidance by using excessive defense mechanisms like humor or intellectualizing or suppression or whatever. We can engage in pathological avoidance by just literally not thinking about something. We can engage in pathological avoidance by trying to minimize talking about it. So there's so many things we can do that are pathological. And what Jade is saying here, which is really important, is that even people in therapy, in treatment, in rehab, can be having counseling sessions, recovery sessions, groups, individual sessions, where the patient is learning to use coping skills to avoid their feelings. And that's not okay. And the reason that's not okay is it's literally no different than using drugs to avoid, or food to avoid, or whatever to avoid. When you're avoiding or distracting, I would tend to use distraction and avoidance synonymously. They're not the same thing from a technical perspective, but they kind of are. So let me say this very clearly. Most of the time, for most mental illnesses, it's very important that you learn to tolerate your feelings and not avoid them or be overwhelmed by them. So you got three choices: distract/avoid, tolerate, or let them engulf you and overwhelm you. Generally speaking, for most adults who are trying to be mentally healthier, the idea is to learn to tolerate things more so they don't overwhelm you and you don't have to avoid them. Okay? So you can use very, very cool, very helpful coping skills like diaphragmatic breathing. If you have any kind of anxiety, 9 times out of 10, diaphragmatic breathing will help to some degree. It's one of the skills that most clinicians teach people when they have an anxiety disorder or a trauma disorder. Now, there's some cases where it's not a good idea, but generally, it's a very efficacious coping skill. So what I will tell you is, you could use diaphragmatic breathing appropriately or inappropriately. So most of the time, if you're using the breathing to just learn to tolerate distress better, then that's really a healthy use of the skill. However, if you're going to do so much diaphragmatic breathing that you feel perfectly Zen and Buddha, that's absurd. The reason that's absurd is because now you're just avoiding the feeling, and that's not the goal. The goal is to tolerate the feeling when you have pervasive anxiety or a trauma reaction or irritation or anger or irritability. Whatever it is, your job is not to avoid that feeling. Your job is to tolerate that feeling and get out of your own way, right? And that's the hard thing that everyone has to do when they're receiving specific treatment. Because if you do the irritable thing, if you do the angry thing, if you do the anxiety thing, if you do the trauma reaction thing, you're overwhelmed by your feelings and you yell and scream and you call people names. Or if you do the distract avoid thing, you suppress it or you stop talking about it or you rationalize it away, which just festers in your soul. So your job is not to make more of a mess for yourself or other people. Your job is to make less of a mess for yourself. And the best way to make less of a mess for yourself is to tolerate the feeling, not to feed it, and not to avoid it. So that's thing number 1. Thing number 2 that she said, which is really important, and this is the art of psychotherapy, to be skillful in how you manage your emotions. So she put the word skillful in her tweet in quotes. And I think for good reason. I can't read her mind, so I don't know why specifically she did. But here's what I would say. Being skillful in using coping skills is hard because learning to use the skills requires awareness and discipline. And people with mental illnesses often are struggling with one or both of those things for good reason. If you're having a bunch of flashbacks, it's really hard to be disciplined because you're overwhelmed all the time, right? And so, as the easy example for PTSD. So what I would tell everyone is that you should have a lot of grace for yourself as you're learning to be more skillful in therapy, in treatment. However, your goal should be, no matter what kind of therapy, if you're doing super deep psychoanalytic 4 times a week whine about your childhood stuff, or if you're doing super shallow CBT, here's a worksheet stuff, doesn't matter what you're doing. Whatever type of therapy you're doing, it should be skillful. You should be learning a skill, right? So in certain types of more depth-oriented analytic therapy, you learn the skill of paying better attention to why you react the way you do to people. Whereas in less deep CBT, whatever therapy, you learn the skill of mastering your mind like a chess player does, right? So like, in CBT, if you learn that your core negative belief is you're all bad or something, then your job is to recognize when you do that move, like you're playing chess, and then compensate with a counter move, just like a chess player would. So that's a skill to recognize and counter effectively a catastrophic thought or a black and white thought, for instance. So being skillful is something you should be doing in good therapy. Good therapy involves learning to be skillful, to be intentional about how you relate to yourself, relate to your thoughts, relate to your feelings. So, Jade, I just want to say I appreciate you greatly because being skillful about using so-called coping skills is super complicated because you can say diaphragmatic breathing is great for all types of distress, but like when to use it and for how long to use it is the skill. because you can breathe for too long and just avoid. You can breathe for too little and just give up and be overwhelmed. And so it's very important that whatever type of mental health services you're seeking out, you're learning a skillful way of being with regard to your feelings and your thoughts. So thank you, Jade, for that first topic today. That next topic, which I think is super important, I'd like to talk about adolescence, if that's okay. Because kids often get screwed by the system. Unfortunately, literally in some cases, but metaphorically in many cases. So let me talk about his posts right now. So Nick Tabor, who I've talked about a number of times recently on this podcast, always puts out thought-provoking tweets on Twitter. So let me talk about two of his posts on adolescent mental health. Okay, just almost there. Okay. So Nick posted two things separately at different times, but I want to talk about them at the same time because I think they're of a kind. So, I think it was December 10th. His handle is Nick Tabor at NickTaber. So here's what he said on 12/10, December 10th of this year. He said, first, the troubled teen industry, in parentheses, which is basically synonymous with most of inpatient youth mental health treatment, is so much about literally punishing kids for their rights and boundaries. So that's post number one. The troubled teen industry, which is basically inpatient rehab, is all about punishing kids for their rights and their boundaries. Okay. Here's the second thing he said, which is related specifically. He said, telling a child something is inherently wrong with their brain based upon a behavioral checklist or totally subjective assessment is highly problematic at best, egregious abuse at worst. So the reason I wanted to talk about both of these posts together is because one typically leads to the other, right? So his first post, which he posted on December 10th, is about the fact that most of the time when kids go into like mental health rehab or whatever, it's because their rights are being violated or their boundaries are being violated. Part two, which is his second post, which was posted today, is telling a child something is inherently wrong with their brain based upon a behavioral checklist or totally subjective assessment is highly problematic at best, egregious abuse at worst. So let me speak to both of these things simultaneously. Let me try and walk and chew gum if I can. So here's what's important about both of these things. So let me be abundantly clear about this. There are many, many adolescents that are not diagnosable that get diagnosed. So let me say this very clearly, that being diagnosed with something in adolescence is usually predictive of adult diagnosis and worse. So from that perspective alone, we should be very skeptical about any kid that was diagnosed with anything, whether it's PTSD, major depression, anxiety, bipolar, whatever, autism, it doesn't matter. The thing we should always be skeptical of is the idea that this kid is so screwed up that they actually warrant a diagnosis. And that's rarely the case. I just mean it's so rarely the case. But secondarily, more importantly, it's often the case that these kids are genuinely, literally struggling with developmental differences that are so complicated, right? Because if you meet a kid when they're 12, when puberty is just setting in, for instance, or a kid when they're 16, when their serotonin system is reorganizing and stuff like that, like you don't even know who you're really talking to in essence, because yes, their core personality might be kind of formed. That's true. But their impulsivity, their intellect, their personality variations might not be fully set at this point. So it makes very little sense to me, at least, to treat them as if they're permanently something at this point, right? So it's very confusing to me because, childhood is such I don't mean this in like a pathological sense. It's a very chaotic or tumultuous time for most kids because most kids go through various changes, especially starting in puberty. So the troubled teen industry is fraught with all sorts of kids who are in really, for instance, screwed up families. So it's very often the case that many of these kids that are acting out also are part of family systems where acting out is normalized and reinforced. And so if you can remove them from the system, their pathological family system, and help the family assert themselves better, cope better, negotiate boundaries better, all these things, then maybe some of their acting out will go away. So oppositional defiant disorder is the best example of this. I think it's generally well established among child psychologists that ODD is not a real disorder. ODD is a shitty parent disorder. And so if your parent or parents or whatever suck at holding consistent boundaries, there's a really good chance that someone with a bunch of anger and sadness will develop a great deal of acting out behavior, irritability, and things like that. So, ODD might develop if your parents suck at holding boundaries. So it's really important, really, really, really consistently important to be clear about the difference between a kid who's genuinely struggling despite their system, their family system, their culture, versus a kid who's struggling because of their family system and their culture. So that's point number one. Point number two is once you've done that math, which can take a lot of time and effort to assess and figure out, after that, then the question is, on what are you basing your diagnosis? Because what Nick said in his second post that's 3 hours ago is like, you're using the CBCL, the Child Behavior Checklist, or something like that. And so you're telling me that this quasi-objective checklist is going to be definitive, when in reality, it's not. It's really not. And that's not even what the research says. So I'm very concerned when kids are diagnosed just based upon objective measures like the CBCL, for instance, because there's all sorts of observer bias, teacher, parent, clinician. So on what basis do you think the kid's actually sick? And have you actually ruled out the systemic issues first, the cultural issues first? Right? So like, just to name a very stupid example, some kids, for instance, are just built different, right? So for instance, some kids have deficits of empathy. Maybe they have deficits of empathy because they're kind of narcissistic. Maybe they have deficits of empathy because they're kind of antisocial. Maybe they have deficits of empathy because they have so much trauma that they don't care anymore. They're like helpless or burnt out. Or they have deficits of empathy because they're autistic, right? So I just named 4 different reasons why a child might have deficits of empathy. And so whether the kid's autistic, has PTSD or something, or is antisocial, or is narcissistic, depending on which of those 4 things is the problem, per se, you cannot just toss them in inpatient rehab and pretend everything's going to go okay. 3 of the 4 things I just mentioned are not going to respond super well to adolescent treatment. You can't take an adolescent who's narcissistically organized, shove them into rehab or adolescent mental health res, and then get it better. That's a personality organization that doesn't change just because you try to socialize them. Likewise for the antisocial kid. Kids that score higher on trait psychopathy are not going to magically get better in a milieu with more normative kids. It's just not going to happen. In fact, what that kid's going to do is it's going to try to rule the roost and maybe corrupt those normative kids. So I would worry about putting an antisocial kid in with more typical depressed, traumatized kids, for instance. Terrible idea. And the autistic kid, that kid's screwed if it goes to inpatient mental health rehab because, oftentimes the staff doesn't understand the fact that they're autistic and what that actually means, like for real, not like the popular media version of autism or whatever. So 3 out of 4 cases of being a little antisocial or having deficits of empathy, not getting along with people in a way that's useful for you, should never be in rehab, basically. So the question for me is, on what is your diagnosis based? For number one, when it comes to teens. Number two, did you actually rule out the family system's issues? Because if the kid really just comes from a screwed up family, a vacation to, mental health rehab, I say sarcastically, is actually going to make them worse, because now you're going to put them in typically an environment with very, very sick kids also, and they'll get sicker. The one that comes from the sick family will just get sicker. So the worst thing you can possibly do for many kids is just put them in inpatient rehab. It's the worst thing you can do, because you're going to take someone who probably would have been fine if they just got some good family therapy, and they would have changed their behavior, right? For instance, in the addiction world, in the substance use disorder world, there's a lot of research, if you don't know, about teens and drugs. So DARE failed miserably. Never do DARE. DARE is a giant waste of time. Screw the federal government. Also, doing individual therapy with kids with drug problems kind of works, but you know what works great? There's like 3 different types of family therapy and systems therapy that works great for kids with drug problems. So there's multidimensional family therapy, MDFT, multisystemic family therapy, and solution-focused therapy. All work great with kids with adolescent drug problems. And so there's so many things you can do to help the entire system around the kid plus the kid, so that everyone starts to change their patterns of interacting and understanding, right? This idea that the kid is broken and needs to be fixed at rehab is just yet another variant of what I call the broken Rolex fallacy. The broken Rolex fallacy is this pathological misunderstanding of people with mental health problems. So the idea is a Rolex is a very special and valuable thing that's very intricate and fancy and complicated, just like a human being should be. But the problem is the Rolex is a thing and a person is not a thing. A person is a dynamic living system, whereas a Rolex is not dynamic and it's not living. So a person is more like an ecosystem and a Rolex is more like a thing. It's a closed system. So it's very important to never confuse people with things, dear autistic friends. So the thing is, it's really, really important that the mental health industry not treat people like things. People are not broken. That's not true. People cannot be broken. That's the wrong metaphor. So adolescents that are troubled, that are struggling, are not broken. And they do not need to be fixed. You do not need to ship them away 9 times out of 10 to some rehab. You need to work on managing, changing, evolving family relationships, family dynamics, communication styles, misunderstandings, and things like that. Now, in some rare cases, dear Nick, who prompted this original conversation, here's what I'll say. Sometimes the kid is the problem. Sometimes the kid is so hurt, so injured, so pathological, right? Because some kids are pathological, just to be clear. Some kids really are genuinely antisocial. Antisocial adults come from antisocial childhoods. So if you have a kid who might have an actual personality disorder when they turn 18, because magically 18 makes you an adult, that kid is the problem, right? And so these different variations in personality function and organization of the mind can be the problem. So it is often the case that people are built differently and they will have a hard time adapting to even typical family systems that aren't super unhealthy. So even healthier family systems can have a hard time with very, very sick kids. So dear Nick, let me say this very clearly to you and to everyone listening and watching. Sometimes the kid is very sick and needs help. But sometimes the kid is kind of sick, but the system is sicker, if that makes sense, metaphorically. So it really depends upon what the truth is. So if the kid is extremely sick, and I've seen this a lot, for instance, with like adopted kids, unfortunately. So kids that are stuck in the foster care system, unfortunately, experience pervasive neglect, pervasive trauma, pervasive abuse, abandonment, such that it really hurts them. It creates this like traumatized, dejected type of character where they just become feral, like an animal. And unfortunately, because of that, you can fix the system as much as you want, but if the family system can't tolerate a feral kid, there's no ordinary family that can tolerate typically a family kid. It has to be an extraordinary family that can help tolerate a feral kid. So it's more complicated than the system is all bad or the system is all good. Sometimes the system is good, but oftentimes the family system around the sick kid is a huge part of the problem, if that makes sense. So really what I would encourage everyone to understand, if you're a parent out there and you're struggling with your kid and you think your kid has a mental health problem of some kind, that's entirely possible. But also consider that what are the family dynamics this kid is growing up in? And in what ways are we showing up the best way that we can? In what ways are we being consistent and reasonable with our boundaries? And in what ways are we not being consistent and reasonable with our boundaries? Because kids need structure. Kids need accountability. And structure and accountability is not some godlike do as I say or else. Threats are very minimally effective, especially for kids and adolescents. So it's really important to be clear about what your boundaries are with your loved one, why you have them, and how effective they actually are, because maybe they need to be adjusted. That doesn't mean you need to give up on your boundaries. Like if you're a parent and your kid's cursing at you all the time and you don't want them to curse at you all the time, that's perfectly reasonable for whatever reasons you have justifications for. So the question is, how are you handling that boundary? Are you handling it by using punishment? Are you handling it by using shaping? Are you handling it by, like, what are you doing specifically? So that's a question. Hola, Phil. Glad you're here. Good to see you. So the other thing that Nick talked about is, so we talked about Nick's post on kids and mental health. How are you basing your assessment? What are you basing it on? But secondarily, the inpatient mental health system, he says, is based purely on like kids' rights and boundaries. So here's the truth. Many of these adolescent programs do take away kids' rights temporarily. So if you as a parent are voluntarily signing up your kid to go to a rehab, then in a legal sense, that rehab becomes the protector of that kid in a very brief, hopefully, period of time. And so it's really complicated what happens to the rights of kids once they're in rehab. And so it's very important that we're extra clear about what types of services are being offered and why, and what rights does the kid actually have and why not. Because like, for instance, here in the state of California where I live, it's very, very black and white what rights an adolescent patient has and does not have. Now, just because it's black and white doesn't mean it doesn't get muddy, for instance, because here in the state of California, depending upon how old you are as an adolescent, you can voluntarily take advantage of services whether or not your custodian, your parent, agrees to it. But then the question is like, how much access does the parent have about your records and your progress and all this stuff? And that gets messy. So the point I'm trying to make is, for everyone watching and listening, is that adolescents don't even know what their rights really are most of the time, number one. But number two, because generally they're in a very messy state, whether or not they have a diagnosable mental illness, you should be 10 times more considerate and thoughtful than if you're dealing with an adult. Because as that kid's mind is developing and changing from the ages of 12 to 21 or whatever, a lot can go wrong and a lot can go right based upon how you actually treat them and guide them. So just to name something super simple, I don't know of any good, reliable pharmacology data that says antidepressants are good for kids. And for instance, I think there was a study that just came out saying maybe don't use SSRIs with kids. Prozac, I think, was the one they were talking about. But I could be wrong about that. But because the adolescent brain is changing, like for those of you who don't know, 3 of your major neurotransmitter systems reorganize in adolescence. Your dopamine system, your norepinephrine system, and your serotonin system all reorganize in adolescence, in puberty. And so when and how you insert drugs into that mixture can be a catastrophic thing that no one takes very seriously. It's very complicated what's happening to the adolescent brain, because of puberty, because of the sex hormones, because of cortisol responses, because of dopamine, serotonin, norepinephrine. It's not super black and white, and everyone's built a little differently before puberty. And so as you reorganize during puberty, it gets even messier. So what I'm trying to say is, when kids are struggling with boundaries, they're often struggling because their brain is a literal chemical mess. Now, just because they're struggling doesn't mean they have no agency. So I want everyone to be clear that what I'm saying is that adolescents are neurochemically a mess compared to some adults. But that neurochemical mess may or may not be because of mental illness, or may not cause mental illness. But the neurochemical mess that is puberty, thanks to hormones, thanks to brain reorganization, makes people look sick even when they're not. Something I tell my graduate students all the time when I teach classes based upon diagnoses is that when you're trying to work with kids, you should be 10 times more skeptical of what you believe the truth is about that kid's mental health and their personality organization, because their brain is literally a mess because of normal developmental differences, perturbations. So it's important, it's extremely important that adolescents be treated with the largest grain of salt possible, because nobody actually knows what's happening in these kids' brains. Nobody. 0 persons. We have terrible imaging data from adolescent brains. Terrible. Low quality, small sample studies. So anyone who pretends to know what's really happening in the brains of adolescents, myself included, is full of shit. So I encourage everyone to be extra skeptical of the mental health system for adolescents, because it's 10 times more complicated neurochemically than if you're an adult whose brain is done cooking, so to speak. So we should be extra skeptical when it comes to the diagnosis, assessment, and treatment of kids and adolescents because of their system, their family system, because of their culture, because of where they're at in the puberty development timeline. Just for those 3 reasons alone, you should be 10 times more skeptical, 10 times more open-minded and curious, and let's say hesitant to use force, to use meds, to use whatever it is that can drastically alter the inner experiences of a kid. Now, this leaves us in a really difficult spot, because if kids are literally out of control, then the question is, what do we do as a society? Do you punish kids? Do you lock them up? Do you take away their rights? Do you shove them into rehab? Do you abandon them? Do you kick them out of your house? All these questions are extremely complicated questions to answer, because in some situations, kick the kid out of your house. That makes perfect sense. In some situations, send the kid to rehab. That makes perfect sense. In some situations, send them to wilderness camp. In some situations, it's so complicated. And so we can't just say, for all kids with PTSD, send them to therapy. For all kids that are autistic, do this. For all kids that look like, there's no simple answer. And it's disgusting when these talking heads say, it's this simple. Just blank. No. It's never that simple with kids. It's never, ever that simple with kids. Never. Kids are 10 times more complicated than adults. So we should always act with extreme caution and extreme skepticism around adolescents in particular. Okay? And again, I want everyone to hear it loud and clear from me. Many of the problems that supposedly plague our adolescents are not problems the kids themselves had. They're problems of crappy parents, inconsistent parents, overworked parents, burned out parents, stupid parents. And it's not because these parents are inherently evil or something moralizing like that. It's because most parents are ignorant. Most parents see their kids through the filters of themselves, unfortunately. Most parents have all sorts of insecurities about being a parent, and fair enough. And nowadays, many people are very, very overworked and overstressed, trying to both be an adult and deal with their kids. It's very complicated and challenging to be a good parent. I don't think most people do a good job because it's not possible in many cases to do your best, if that makes sense. So what I would encourage everyone listening to consider is that it's very hard, it's very complicated to truly understand what's happening with the kid, which is why you should spend a lot of time watching and listening and taking in data and observing patterns. Before you send your kid away to rehab, maybe get a full evaluation. Maybe allow someone like myself, and I'm not plugging my services just to be clear, but like there are very talented assessment-oriented clinicians, family therapists, etc., whose whole get down is looking at the entire system, looking at the dynamics, the triangles, the boundaries, all these things, and going, okay, let's formulate a hypothesis about what's actually happening here. And once you've formulated that hypothesis, then the next thing you can do is run an experiment. And so you can run the experiment of communicating differently, of softening that boundary, of making that boundary more firm. Whatever it is, you run the experiment and you see if anything changes. And so running those experiments for a few months before you ship your kid off to rehab is usually a very good thing. But sometimes the family system cannot change very well or very reliably. And that is a bigger problem. So sometimes removing the kid from the home temporarily allows the parents some peace of mind, some freedom to become more resilient. So it's very, very complicated. I hope you all understand how complicated this is. Okay? All right. Now let's talk about personal responsibility. This one's going to be interesting. So let me repost this real quick. Okay. So December 12th, my buddy Ryan McRogers at RyanMcRogers on Twitter, Ryan McRogers, said, here's what he said. Personal responsibility is the foundation of mental health. I'll read it again. Ryan McRogers said on December 12th, personal responsibility is the foundation of mental health. Here's what I said in rebuttal to that. First, personal responsibility is an attitude. It's extremely helpful in therapy if used correctly. However, there are pathological variants of personal responsibility, such as the cognitive error of personalizing. So let me walk through that. So in conservative circles in particular, especially in the culture war, conservatives and their ilk, their type, talk a lot about personal responsibility and personal accountability. And I think for good reason, because in many cases, people avoid personal responsibility and accountability because it's terrifying being a real person. It's terrifying being an adult. Because if you're really an adult, you have to look at the entirety of your life and take responsibility for everything that's under your control. And why that's terrifying for the average person, because the average person is average, it's terrifying to take full responsibility for all the things that are in your control because so few things are in your control. So the number one thing that's in everyone's control is what they do immediately following an awareness of something happening inside. So if I notice that I'm anxious inside, I am fully responsible for what I do the moment I notice that. I have choices. I can avoid what I'm noticing. I can think about what I'm noticing. I can do something about what I'm noticing, like cope or breathe or joke or whatever it is. So once I notice that thing, it's my full responsibility to do something with what I'm noticing. And that, I believe, is exactly why my buddy Ryan said what he said, that personal responsibility is the foundation of mental health. Especially if you read books on like acceptance and commitment therapy, ACT. The truth of the matter is that it's really depressing. If you have a wish to be rescued, if you have a wish for things to get better, if you want your life to be fixed by somebody else, right? I just wish my husband or wife treated me better. I just wish society treated me better because of my age, my gender, my sexuality. I just wish whatever, right? Just continue to fill in the blank with those examples. I just wish the world was more designed to suit my particular individual needs and wishes. And gosh, wouldn't that be awesome? Me personally, as just regular old Patrick, I wish the world was, built to accommodate to the shit that I think and care about, but it's actually not. Because life is complicated. There are billions of people on this planet. There are dozens of personality variations. There are hundreds of cultures and hundreds of languages. There's no way that the world in total is going to respond best to just my unique needs and interests and differences. It's not going to happen. So because of that, the average person is just average. They just have this average wish that the world was more accommodating to whatever it is they wished and needed. And that's terrifying. And it's even depressing for some people because some people really got the short end of the stick. Some people had a really terrible childhood. Some people had really abusive parents or neglectful parents. Some people had a lot of discrimination because of their race, because of their sexuality, or anything like that. Some people grew up with pretty useless family members, abusive brothers and sisters. So there's a lot of people that literally got the short end of the stick. And so it's perfectly rational and reasonable to wish that society was more accommodating because of all the unfair stuff that happened to us. That's not pathological. That's normal. That's ordinary. So what the conservatives get wrong, I believe, is this idea that people are just supposed to pull themselves up by their bootstraps, even when they've been dealt a very shitty hand. That makes no sense to me because it assumes that we should make zero accommodations for zero reasons. When the truth is, most cultures on the planet have been making accommodations for different types of people since, prehistory, essentially. Whatever records we have of different societies that have existed in Egypt and Africa and Asia, we have lots and lots of records, historical, anthropological, that shows people accommodated to people of different genders, skills, and talents, right? There's a division of labor in most tribes that have existed on the planet. There's a division of resources based upon skill, talent, status, things like that. So it doesn't make any sense whatsoever to kind of like hold the talking point, pull yourselves up by the bootstraps, and to get zero accommodations for life. So on the one hand, I think personal accountability is a bit of a not wanting to deal with the complexities of life. It's a defense mechanism, especially people on the right. And I'm not saying this in purely political terms. I'm saying this because there's a lot of people in mental health, especially in like the addiction and recovery world, that talk endlessly about personal responsibility, but are also terrible role models of personal responsibility. And so let me be very clear that I think a lot of people are just projecting and stating their fantasies and wishes about themselves out loud and putting them on other people. I'm such a terrible hypocrite. I wish other people were less hypocrites, is kind of what happens. I suck at holding my boundaries with my wife, so I'm going to preach to you about boundaries with your wife. I think that happens all the time in the treatment industry. I think it happens all the time in the addiction industry. There's a lot of people that supposedly get sober or something like that, but then they just have the worst relationship with sex and food and nicotine and caffeine. And they just project all day. They're like, you got to get sober, you're going to die, and the fear of God and all this crap. But their lives are miserable, and they're the worst human beings on the planet. But just because they haven't drank in 30 years, but they're terrible, miserable narcissists. So let me be clear that a lot of people who are talking about personal accountability are just projecting. They're projecting their wishes that they could take more responsibility in their life to have a better life. So I think that personal accountability is extremely important as an attitude. However, it's not like we're supposed to have one attitude at all times. Human beings have different attitudes for different situations, right? So if you're playing around, personal accountability is not super useful because it ruins creativity and play. It's a stupid attitude to have in that context. So what I would tell everyone is that you certainly need to take a lot of accountability. In fact, the average person walking around, myself included, should probably be more accountable. Should probably take more responsibility. However, it's really important to not live in a glass house and throw a bunch of stones. And I think a lot of people who talk about personal accountability live in very, very flimsy, fragile glass houses and throw rocks all day. So my take on personal accountability, mental health is this. If you have signed up for therapy, if you've chosen to go to rehab, if you've chosen to go to AA, etc., if you've chosen to see a therapist, a counselor, a psychiatrist, I hope that if you are a patient, if you are a client in therapy, whatever, that you take full accountability for what you signed up for. If you have voluntarily signed up to talk to a therapist, to talk to a psychiatrist, you have 100% responsibility for what you signed up for. So the question that you should be asking yourself is, before I go see a therapist, before I go see a counselor, before I go to rehab, before I go to AA, before I go to couples counseling, before I go to family therapy, what am I signing up for? And if your therapist is not a hack, they will tell you what you're signing up for. That's what we call informed consent. So, ethical therapists, let me say this as clearly and unambiguously as possible. Ethical therapists will conduct informed consent in the following way. They will say, this is how I do therapy. These are the interventions and skills that I believe are helpful for people with your particular struggle. This is how I understand your particular struggle so far. It may change. These are the boundaries of therapy. Don't contact me on the weekends or whatever. And this is your responsibility as the patient, and this is my responsibility as the therapist. If those 6 things I just outlined do not happen in your informed consent process, then your therapist sucks. And it's that simple. It's really unambiguous. It's cut and dried. Because those 6 things aren't even the whole thing. That's just the first 6 things that are the bare minimum to provide an ethical framework for continuing forward in therapy. So let me be perfectly clear with everyone that personal accountability is dictated by what you specifically have signed up for, right? No different than any other relationship. In a friendship, in an employer-employee relationship, in a romantic relationship, whatever specific deal you've negotiated, that's what you're obliged to do and not do, right? So in therapy, the way that I'm just going to use myself as an example. On the rare occasion I actually do therapy with people, the framework, the metaphor that I use is that therapy is experimentation. So you and I are going to sit down, we're going to talk, we're going to get to know each other, we're going to understand each other, and then what we're going to do is we're going to co-construct an experiment together. We're both going to be researchers. And so maybe the experiment is go home for a week and practice diaphragmatic breathing 30 minutes before bed so you can sleep better, right? That's the experiment. That's it. It's not life-altering, or maybe it is. I don't know. I won't know until we actually run the experiment, but it's an experiment that we are both going to discuss, explore, and create together, right? That's how I frame it. And that framing puts us both in the driver's seat. We both have accountability, right? So I am responsible as the therapist in this fictitious example to help create the experiment with you, to have knowledge and expertise of some kind that allows me to make specific educated guesses and offer ideas. And then your responsibility in this scenario around sleep is to tell the truth about what your insomnia looks like, what you've tried, what you haven't tried to do to fix your insomnia, and to be open to new things that might help your insomnia. That's it. Those are the 4 things you're responsible for. And so you have personal accountability to do all the things you said you would do. You have to do those 4 things, which is to tell the truth, which is to tell me what you've tried to help your insomnia, which is to tell me what you haven't tried, and to be open to new things. 4 simple things that are your responsibility when you do this, CBT for insomnia thing with me. That's it. It's not rocket science. It might be emotionally complicated because you have childhood stuff and I remind you of your dad and you remind me of my ex and whatever it is. But all that complicated psychodynamic stuff is a set of layers on top of this very concrete personal responsibility conversation. So I hope everyone watching and listening understands that the boring, boilerplate, conservative way of talking about personal responsibility has no place in therapy, because it doesn't actually adequately address what I described just now, which is informed consent, right? Ethical therapy is all about the frame, is all about informed consent, is all about having a collaborative partnership where both people have responsibility for experimenting and creating a new outcome together. So personal responsibility is extremely important in therapy as an attitude if it is done correctly. And to me, it is done correctly if it's done ethically and it's done from the perspective of informed consent. So if your therapist doesn't talk to you about informed consent, if they don't say, here's what I think I know, here's what I don't think I know, here's what may be helpful, here's what's not going to be helpful, if they can't have that conversation with you, that's not informed consent. That's not ethics. And that is not personal accountability. That's a therapist who's pretending to be a guru. That's a guru therapist. So don't settle for less. Ever. Because if you're paying for therapy, you deserve the best possible outcome and the most collaborative and ethical partnership possible with your professional. Okay? So there's a lot more I wanted to talk about today. Unfortunately, we're just out of time. Time has flown by. I really appreciate all of you watching and listening. Looks like there's a number of you watching and listening but not commenting, and that's totally A-okay. Today's a little bit more of a rant day, and that's okay. I thank Nick Tabor for his post. I thank Ryan McRogers for his post. Thank you both for the grist for the mill. You are both respected and appreciated. Thank you, Phil, for coming out to chat. It's been a good little podcast here. We have so much more to talk about next week. And although next week is the weekend after Christmas, I will be going live. So come back out and let's chat. Let's talk about how Christmas dress went and didn't go. And it'll be fun. I think we have some interesting topics coming up for next week. And so if anything I said today was helpful, thought-provoking, interesting, irritating, whatever it is, please like, share, and subscribe. Please get the word out. Because my only goal, literally, I have 48 episodes of this online. That's proof. Like, my goal is not to trash the profession so you don't like it. My goal is only to promote healthy skepticism, healthy criticism of the profession so you know exactly what you're getting and you get the most out of the professionals you're working with. That's all I'm about. Okay? So thank you for coming. Thank you for watching and listening and talking and sharing and being part of this, messy weirdness with me. And as always, I like to end this with a joke. And so without further delay, here is today's joke. So I once had this patient who had a really severe case of schizophrenia. Schizophrenia is the condition where you have positive symptoms like hallucinations, delusions, and things like that. Negative symptoms like avolition, amotivation, poverty of speech. Anyway, so this young man had a really tragic case of schizophrenia. And he didn't really quite hear voices, but he heard people singing in his head, which is interesting because most of the time when I've treated people with schizophrenia, they've usually heard voices. They've heard a variant of themselves or family members or friends or just random people from society. So this person heard people singing, which was news. It was news to me. I've never seen this before. So I said, this is really strange. And so I tried to explore actually what the content of the singing is about. And since Christmas is coming up, for whatever reason, the voices in his head were only singing the song All I Want for Christmas Is You by Mariah Carey, which is a song I can't stand, but whatever. And when I tell you he wanted to die because of these voices and how annoying the song is, all I could say was, I understand. I'd probably want to die as well. So anyways, as I do with all people that are struggling with very severe hallucinations and suicidal ideation, I send them to a psychiatrist because I cannot prescribe. And so I sent them to one of my colleagues who's a psychiatrist to try maybe a medication if they wanted. So, unsurprisingly, my patient came back the next week and he had 0 hallucinations 2 days after he started his medication. He said, literally, I couldn't even say hello. The first thing he said to me when he sat down was, thank God, the voices are gone. He said, no more of that terrible song. And I said, well, I guess that's not music to your ears, huh? All right, folks, good to see you. See you next week. Take good care of yourselves. Have good food, have good sex, have good fun. Do everything that's good for your health. I will see you next week. Goodbye.